So our course faculty, we're going to start out with Dr. Abaza, Ronnie Abaza. He's the Director of Robotic Surgery at Ohio Health in Dublin, Ohio. Ronnie and I have known each other for many years. We actually went to the same medical school, grew up in the same town, Toledo, and we were both very happy to get out of there and run as fast as we could. But it's a great place to grow up, great place to leave as well. But Ronnie's been a real pioneer in many of the advanced techniques that you are familiar with, and he's going to be able to lend his expertise in many areas today. Kate Badani, also a good friend from Mount Sinai, New York. Caton is the vice chair at Mount Sinai, and has really also been a huge pioneer in changing the way we do robotic renal surgery, and I'm really glad he's made the trip here to Seattle. Jonathan Harper is local. Many of you know Jonathan at the University of Washington. He's chief of endourology and MIS surgery there. Does a very high volume of robotic kidney surgery. And we're actually quite excited that he's going to lend his expertise to our group today. Tim Brand, also somebody local. Many of you know. I know we have a few of the people from the military here, and we're quite pleased to have you here to keep us in line, because it's going to get out of hand, I'm pretty sure. But Tim's been and actually done a lot of work with training, simulation, and how we make things better, how we train people to do difficult tasks, and we're excited to have Tim here to help us with this course. And then my fellow, Harshan Medakani, he's going to be presenting and doing all the things that a fellow does, which is the things that nobody else wants to do. So he's going to be helping us with the patient presentations, as well as going back and forth, making sure the surgeries are going well. So we have kind of the overview is 2 live surgeries today. We're going to do a retropartial. I know many of you are interested in this approach. And then we have a nephroureterectomy, which we're going to be doing with the XI. We've got a lot of, I think, state-of-the-art, cutting-edge didactic lectures. And then we're actually, not only do we have the kind of the live surgery going on here, we're actually going to be streaming this course online over the internet with Mark Schwachter of MHS Technologies. So this is going to be, people are actually online right now. I think we have about 150 people online watching this course as we do it live here in Seattle. So what are the goals of this course? Well, I like to think of experience as learning from your mistakes, and then education is learning from the mistakes of others. And that's actually what we're going to show you today. A lot of our own mistakes, how we learn from them, and hopefully you'll benefit from that and shorten your learning curve. So you're here to learn from the experts. You're here to try to shorten your learning curve. And of course, the goal of this is to benefit your patients with a technology that allows you to have less impact to patients after surgery. And so the way this happens, of course, is to ask questions. You don't learn this in a vacuum. It's important you ask questions. This is supposed to be interactive. We have people here that are used to answering questions, and if they don't know, they'll tell you. But in most cases, there's usually an explanation for what's going on. We have many people to thank for this course. First of all, we want to thank Intuitive Surgical. They've provided an educational grant to make this masterclass possible. We also want to thank ConMed. They've been a big sponsor. They're actually the sponsors for the Internet Cast. Scanlon International, the people that make the bulldogs that we use for partial, have been a big supporter of our courses in the past and currently. And then the Swedish Foundation, they made this possible as well with their donations to allow us to use this center. And of course, Seattle Science Foundation, where we are today, they've been a great partner in our courses in the past, and we're very, very pleased and happy to work with them again. And then Veritas Meeting Solutions, Sue, Debbie, Jennifer, Christina, these are the people that really make this course happen, so we want to thank them for their work. And then, of course, I want to thank the people at Swedish that I work with daily that make this possible. And of course, when you make a robotics program, it requires some vision. It requires, obviously, the technology, and that technology has changed over the years. But most importantly, it requires people. You can give me 10 robots, but if I don't have people, nothing happens. So my staff is outstanding. They do a great job to make what I do happen. And then there's some individuals. Brandon, this is my bedside assistant. You're going to hear, I'm going to refer to him as Brando all day, but Brandon is somewhat famous. He goes, he's been around the world with me doing surgeries, and he's been a mainstay and kind of a consistent thing, consistent person in my world. And then Jen, she's my scheduler. She makes everything happen. She's my assistant. She makes it all work. So I want to thank her as well. I also want to tell you that this master's class is part of a bigger group, and that's the NARIS group, and we have an annual meeting every year, and this year it's in Vegas in February, and this is really a much bigger scale of what we're doing today, covers all the areas of robotic surgery, and we have the world's leaders in robotic surgery as faculty. Live surgery is a big part of that. I think this year we're having 6 live surgeries. It's a day-and-a-half procedure. We're also going to have a session dedicated to young robotic surgeons that are just starting out. So an area where you can actually interact and ask questions without feeling like you're holding up the show. So there's a young robotic surgeon meeting the evening before the meeting. So that would be on February 7th on that evening. But we're excited about NARIS. This is our 3rd meeting, and we are really dedicated to continue to make this the best meeting in robotics that's available. So I strongly encourage you to sign up for this, and I think you'll be happy you did. So with that, I'm going to move on to the first lecture because I'm going to run away.